Welcome to NTN Nightly. I am Janelle Novell. This edition's top stories. Prime Minister the Honourable Alan Chastanet tells Parliament an extension to the state of emergency is critical as COVID-19 cases and related deaths continue to rise. Several measures are being taken to address perennial problems at the Bordelais Correctional Facility. And the Ministry of Health and Wellness implements a new isolation strategy in the battle against COVID-19. As the government of St. Lucia continues to manage the COVID-19 pandemic and further contain the spread of the virus, the current protocols and measures have been extended until Tuesday, 16 February 2021. The restriction on the sale of alcohol has also been extended until Wednesday, 24 February 2021. As per the decision by the Parliament of St. Lucia, the state of emergency has been extended until May 16, 2021, with a curfew from 7 p.m. to 5 a.m. Please note that the state of emergency and curfew can be reviewed, amended or discontinued pursuant to regulations by the Governor-General. A meeting of the National Emergency Management Advisory Committee (NEMAC) and stakeholders is scheduled for later this week in order to assess existing measures and decide on the way forward. The government of St. Lucia continues to thank all St. Lucians for the cooperation necessary to curtail non-essential movement to reduce the transmission of COVID-19. For more information on St. Lucia's COVID-19 response, visit covid19response.lc. The House of Assembly on Tuesday debated the extension of the declaration of the state of emergency for a further 90 days commencing the 11th of February and ending the 16th May 2021. Parliament's approval of the motion allows for the imposition of a curfew. Prime Minister the Honourable Alan Chastanet told the House that the measure is necessary as COVID-19 cases continue to rise with increasing fatalities.
An analysis indicates that over 55% of the persons between age 25 and 49 have tested positive for COVID. Our contact tracing data also indicates that most of the cases and contacts of cases are as a result of breaches in the social sector. Whilst over the last few weeks we have pulled back and limited social activities, there is still mounting evidence of social events taking place, especially in the evenings at private locations. This is among the biggest threat in our fight against COVID-19, and hence the need for the curfew, which now will allow the police to better manage and contain these illegal activities by restricting movement at those times.
Honourable Chastanet noted that the health system is feeling the impact of the rising cases. Although not yet overwhelmed, the situation can become dire if stringent measures are not taken.
There is no denying that law enforcement has been stretched at this time. Our police have not been spared from the health impact of the coronavirus, and in some cases we've had to close down police stations and deep cleaning work areas, even while some police were waiting on test results. In addition, these challenges our police are dealing with, the breaches of COVID-19 protocols, our police have also had to manage their daily crime-fighting activities. This has taken its toll, and as a parliament, we must accept our responsibility to assist law enforcement in coping with this pandemic. To put it into context, between the period of the 27th of December 2020 to February 6th of 2021, the police dealt with 643 breaches to the COVID-19 protocols.
The extended state of emergency, Prime Minister Chastanet indicated, would assist the health practitioners, including the contact tracing teams, as well as the police, whose resources are stretched due to COVID-19. The Ministry of Health and Wellness remains focused on managing the current surge of COVID-19 cases diagnosed in country. The ministry has thus far utilized a mixed model of care which allowed for the management of mild cases to take place within communities. These cases have been monitored by a dedicated medical team overseeing cases being managed at home. This approach was taken given that approximately 80% of people diagnosed with the virus experience fairly mild symptoms. As a result, a large number of cases remain at home to isolate and receive care until recovery. Chief Medical Officer in the Ministry of Health and Wellness, Dr. Sharon Belmar George, says, however, an adjustment is required.
In undertaking routine reviews of the national plan to manage the COVID-19 outbreak, which includes the treatment and care component, the Ministry of Health recognizes the need to adjust this model of care. There has recently been a large number of persons being managed in community. This, combined with the inadequacy of the homes to give the required isolation as well as breaches, has resulted in changes to the care of our confirmed cases. Home isolation is now being transitioned to state-based isolation facilities. Effective immediately, this change now means that mild cases are being placed within hotel sites, and the moderate to severe cases continue to be cared for within the National Respiratory Hospital. This allows for a greater degree of vigilance in the management of the milder COVID-19 cases, given home isolation cannot be effectively conducted for some individuals who are in care.
These changes have been made primarily to protect the health and safety of all, not only people diagnosed with the virus. It is expected that this new model will support efforts to contain the virus and will allow for more focused care being delivered to all patients as their period of infection is being managed. Minister for Home Affairs, Justice and National Security, Senator Honorable Herman Francis, has confirmed that going forward, the smuggling of contraband, including cell phones, into the Bordelais Correctional Facility will be subject to extremely high scrutiny by prison authorities. This as the inmates violated prison rules by taking to social media via live stream broadcasts from mobile phones to vent their dissatisfaction with the way in which the COVID-19 virus was being managed at the prison. Calm has since been restored to the Bordelais Correctional Facility and more specifically the remand block of the compound. However, the authorities are remaining vigilant and assure the public that the inmates are being supplied with COVID-19 protocol information, face masks and gel hand sanitizers. Concerning the pace at which the courts of law hear cases, the National Security Minister noted that like many other sectors, the pandemic has also adversely affected the judicial system. Notwithstanding, he made the point that several individuals who are on remand have been granted bail. However, they are yet to meet the bail conditions, which essentially include cash or suitable surety. Speaking optimistically about the future, the minister announced that 2 new judges have been added to the roster to hear matters, and this he hopes will assist in alleviating some of the backlog in pending court matters.
The Chief Justice has added on the roster an additional judge to deal with matters virtually. The Chief Justice also announced in her address at the opening of Law Week that criminal trials before a judge only was on the horizon. I have taken a document to Cabinet which was approved to facilitate trial by judge only, more popularly known as bench trials. And we have put in a committee together, and the committee is made of the Attorney General or his delegate, Special Advisor to the Prime Minister's Security, the Permanent Secretary in the Ministry with responsibility for Justice, nominee by the Bar Association, nominee by the Eastern Caribbean Supreme Court, Registrar of the High Court, and somebody representing the DPP's office. We will also be looking at cases where inmates have been on remand for an inordinate length of time, to be in a position to make recommendations to the relevant authorities, including the DPP and the Governor General. Parole has now been added and must be looked at by the inmates as a rehabilitative tool. If the inmates, by their conduct and industry and participation in the programs being offered at the facility, they can be eligible for parole.
Minister for Home Affairs, Justice and National Security, Senator Honorable Herman Francis. The Ministry of Health and Wellness, in collaboration with the World Bank Group, seek to initiate a new pragmatic approach to health care. More in this report from Perennial Neptune.
The initiative is referred to as the Performance-Based Finance Mechanism and is a major part of St. Lucia's health system strengthening project. Performance-based finance coordinator of the St. Lucia Health System Strengthening Project, Niam Jean-Baptiste, explains, this system provides incentives or benefits to both the providers and receivers of healthcare.
First of all, we want to reduce mortality from communicable diseases. In our case, we are focusing on diabetes and hypertension. So this would be the overall goal, to reduce mortality and also, if you want, consequences of diabetes and hypertension.
Jean-Baptiste notes the aim of the initiative is to improve healthcare in St. Lucia, to produce positive outcomes to patients, and to encourage people to utilize the health services.
So there are two sets of people receiving incentives. One would be let's look at the most important persons, the clients. So the clients would receive free, for now they would receive free laboratory testing. The persons who provide the service, what they will do, they will be receiving additional funds, which they could use under agreed conditions based on their performance. So if, for example, we set a target and then they have achieved the target or surpassed the target, we're going to reward them or provide them incentives so that they can use that service to enhance the services, maybe to train their staff or to do other things.
Performance-based finance programs are prevalent in many low and middle income countries, but the system will be new to St. Lucia. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Perennial Neptune.
This is NTN Nightly. Up next, Primus Hutchinson with the NTN Nouvelle, a Creole. Stay with us.
A habit of daily caring for the teeth, tongue and gums not only improves your oral health, it also helps maintain a healthy body. Here's how. Be sure to wash your hands and your food before eating. Rinse your mouth thoroughly after every meal and after brushing your teeth. Floss at least once a day before you brush your teeth along the lines of your teeth. Brush at least twice a day, including before bedtime. Ensure you cover the entire tooth surface. Avoid sticky and sugary foods, including candy, as well as carbonated drinks, as they increase your chances of getting cavities. Consume lots of water, fruits and vegetables daily. Wait at least 15 minutes after having acidic food and drink, such as citrus fruits and soft drinks, before brushing your teeth. This prevents damage to your teeth's enamel. Visit your dentist twice yearly. For further information, call the Dental Services Unit of the Ministry of Health and Wellness at 468-5314.
Welcome back. We join Primus Hutchinson for the NTN Nouvelle, a Creole.
Merci autant, Janelle. Monsieur, Madame, département qui nous responsabilité pour information à gouvernement St. Lucie, ça c'est GIS, à ce même télévision nationale pays à NTN, caposateur nouvelle à Creole, présentateur Primus Hutchinson. Ministre de Santé St. Lucie annoncé que St. Lucie a reçu 2000 la vaccine hot pays Dominique. Ministre qui a responsabilité pour santé, honorable Mary Isaac, fait annoncement durant programme Nouvelle Creole à sur télévision NTN jeudi bon matin. Madame Isaac fait comprendre c'est le premier annoncement que j'ai fait à sur développement ça là et qu'il y a un espoir qui cette la vaccine ça là quand tu cette Lucie souhaite plus tard jeudi eh bien vendredi
2000 vaccines qui sont sortis Dominique monsieur même batch même AstraZeneca
oui.
qui a sorti Dominique gouvernement Dominique a offert nous ça avec yo ka voyer à sous RSS ban aujourd'hui.
Premier ministre cette fois-ci, honorable Alain Chastanet a aussi annoncé en cahier parlement mardi passé qui pays Barbade j'ai offert cette fois-ci 1000 la vaccine ça là. Un effort pour essayer de ménager et réduire à sous des maladies corona. Car si manger un pays, le gouvernement cette fois-ci j'ai allongé à sous ce protocole pour juste le 16 février 2021. Restriction à sous la vente alcool, j'ai allongé aussi pour mercredi le 24 février 2021. Quand Parlement, eh bien, quand il concite sur mieux, j'ai aussi allongé à sous sélection, eh bien, curfew pour le 16 en mois de mai 2021. Commencez à 7h soir pour 5h bon matin. Organisation NIMAC qui tient un meeting tout de suite pour déterminer et faire assessment concernant ces démarches-là qui sont en place et à qui meilleure façon pour improver. Ces logements qui sont en place, c'est pour plus de monde rester à Kaipito pour faire travail, c'est normalement qu'à faire en place travail. Toute place business et activité commerciale n'est pour bout à 7h soir. En parmi eux, c'est restaurant et supermarché, ça veut dire supermarket, ils tout supposé fermer et la J travailleurs à 7h soir. L'autre business qui a poursuivi service qui est nécessaire, qui est resté ouvert. Par exemple, les manufactures, business agricole, call centers et l'hôtel, parmi ces services qui sont restés en opération. C'est services pétrole aussi, services financiers, supermarché, restaurant. Mais ces restaurants, c'est seulement pour amasser manger et tirer encore la même. Transportation publique, les revendeuses, secteur agricole, bureau docteur, tout service de santé, bureau avocat, service utilité, garage, et service pour l'auto, service qui est nécessaire à l'opération gouvernement aussi, ça veut dire qui est plus critique que l'hôpital, service les pompiers, police et immigration. Opération service pour ça c'est service pour ni à sur la mer et avion, ni mot et utilité publique. Pièce activité publique pour organiser et pièce groupe et bien les individus par ni pour chaîne activité ni en public et bien privé. Et les individus ni pour chaîne contact seulement parmi la famille qui a caillé. Absolument pièce musique pas ni pour jouer particulièrement si son a sorti trop fort. Service l'église, ça n'est pas plus que 25 personnes, ça veut dire parmi pasteur, prêtre et l'autre officier. L'enterrement, baptême, mariage, c'est pour seulement 10 personnes. Restriction à sous licence, boisson, qui a resté 6 personnes en supermarché, petite boutique, service pétrole, cabaret, pour juste le 24 février 2021. L'année restriction à sous toute activité sport. Yon kaini brisé permission pour conduire étonnement en situation de yon moun pour yon lot. Toute l'école, ni privée et publique, qui est restée fermée, et les leçons qui sont faites par médias sociaux, à part les étudiants médicaux, les étudiants en grade 6, et les étudiants qui ont suivi les leçons à l'université. Les étudiants à l'école secondaire, forme 4 et 6, et les étudiants qui ont préparé pour l'examination, c'est sec, à parmi l'autre. Moun qui a souffert et puis malade depuis ça, direct pressure, en position pour recevoir meilleure assistance à présent. Ça a fait un projet qui est en place pour renforcer le système de santé à cette lycée et qui pourra sortir à d'ailleurs programme finance pour aider à hausser performance en diverses façons en pays cette lycée. Coordinateur pour le projet ça Néam Jepatis expliquer objectif là c'est pour sauver la vie plus monde qui ni maladie pressado et pressure et pour établir façon côté service là qui est available pour réduire à ce degré et pèse maladie à cette lycée.
Nous pas juste faire bagaille vaille. Nous avons garder information, nous avons voir qui moun qui a souffert plus, nous avons voir côté qui moun qui a voulu plus assistance et nous avons servi information ça. So nous avons un service qui est plus bon pour tout le monde.
Sinon, M. Jean-Baptiste, projet kay pour un certain groupe monde, mais aussi kay embrasser l'autre citoyen en bas un service santé universel côté yo pas kay ni briser payer pour trouver ce traitement ça là.
So projet ça et pilot ça ka garder 4 services. Nous ka garder 2 pour Pisadou et 2 pour pressure. Ça nous ka garder aba Pisadou c'est nous ka tester moun pour voir si on y Pisadou et ça nous trouver qui ni Pisadou nous ka traiter yo. Nous ka faire même bail là pour diabetes et hypertension. So et then nous ka faire comme si c'est pas nous ka garder pour chaque commune, chaque health center qui a chaque commune et pour faire ces bagages ça par chaque health center. So là nous fini nous pareil juste nous ka commencer à pilot là mais après 2 l'année 3 l'année nous ka faire pour whole pays.
Monsieur mesdames, ça c'est côté nous à toi bout nouvelle là pour aujourd'hui. Mon ka remercier autant pour regarder mon ka avoir une invitation pour jeune puis moi conserver la vie dans les poste de l'autre nouvelle après ça mon ka vivre présenter au channel.
Merci Appeal Primus. That brings us to the end of NTN Nightly. Join us next time at 7 p.m. with a repeat at 7 a.m. You can also catch up with us anytime on the St. Lucia Government Facebook page or YouTube channel. I am Janelle Norvell.